Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you.
Good afternoon, folks. This is Dr. Shailinder Sodhi on the show Your Body's Natural Pharmacy.
And this is Dr. Anju Sodhi along with Dr. Shailinder Sodhi, and we are talking on digestive health issues today.
And this topic is so common, Dr. Anju. I mean, you and me,
yes.
We both practice in Bellevue Clinic. And every day, whenever we are seeing patients, there are at least 20 to 30% of our patients which do come in for the digestive health issues.
And many times, like if they are not coming for the digestive health issues, if they are coming for the other reasons like fatigue or any other, we find out that digestion is the main thing which we need to address before we address the other issues.
Right, because the thing is, it's so important. Anything we put in our body has to be digested, and the body absorbs the nutrients and all the protective things which can enhance our immune system, and that we get from our food. So it's a really important thing that we have to address digestion in almost every case.
Very important, Dr. Shailinder. And also, I always tell my patients, if our digestion is not strong, then we do not digest the things properly. It can be food, it can be any supplements we take, and then we don't get the results.
And the thing is, every one of us, all the people in the world, once in a while or sometime in their lifetime, they will face major digestive issues.
Yes, of course.
Either you're traveling or you're going out or you're just camping outside. These are the things which will happen. In one statistics, there are about 70 million people every day. 70 million people. And that's a lot of people who suffer with digestive issues. Some minor, others not so minor. And people who have major digestive issues, they really they can tell you they do not feel their best.
That is very much true.
And some of the things which we kind of are going to go over are from the most common issues from, we call GERD, gastroesophageal reflux disease, which is nothing but is an acid reflux.
It's an acid reflux. When people are not digesting the food properly, they start producing a lot of acid, and which comes into the esophagus, and then its condition is called the GERD.
Yeah, and the most common symptoms are like they feel burning pain in the middle of the chest, sometimes pain.
Yes.
And sometimes it can just mimic like a heart attack.
Yes.
So, that's very important for people to understand when they are having acid reflux, or if it is a heart disease, it could be a heart attack. So, whenever that type of suspicion is there, I do recommend that you should see your physician immediately or go to hospital if you are not very sure. If it's a heart attack or GERD, which is gastroesophageal reflux disease. So, this is about 20% of the population in America which has a gastroesophageal disease, and some are chronic. And that is a majority time we find, it can be people who experience gastroesophageal reflux disease can have a heartburn, persistent heartburn, and sometimes bad breath. And if you notice tooth erosion, simple, tooth erosion, that is because of...
Recently, I was treating a patient with the same symptoms, and she's in her, the 30s, not very old, and she's having the tooth issues going on.
Right, so they
along
lose
with
their...
the other...
Right,
yes.
Mostly they lose their enamel.
Yes.
And, they don't know what's causing it, and they start losing the teeth. So it's that's because of the acid reflux, which is constantly happening while they're asleep.
Yeah, and then they do not know that they are producing that many acids, and the people are still having the tea or coffee, and these things are even making their symptoms worse.
Right. So, especially I think we love to have our coffee. We live in Seattle area. We are capital of coffee. We are the producer of coffees in the world. We have made coffee so popular. Nothing wrong with the coffee, but guys, when you're having gastroesophageal reflux, this is one of the things.
You cannot have it. Your body is producing more acid, and that is the problem. You are having a lot of the digestive issues then.
Right. So maybe we need to reduce that. That's one simple fix right there. And, if then there is other issues with the GERD is nausea. If again they feel nauseous each time, they are either having an empty stomach, they feel nauseous and pain, or sometimes it improves with eating, other time it gets worse with eating. So, if that is happening all the time, you need to be seen. You need to be seen by naturopathic physicians or somebody whom you trust can take care of your health. It can be pain in the chest or in the abdominal area, or sometimes even swallowing.
Swallowing, yes. A lot of times people come and they complain about it's hard. They can't swallow, and this is due to the acid reflux.
And I also have noticed some people say they even have breathing difficulties.
Yes.
That again, these are all very serious symptoms, which can people sometimes not really understand if this is an acid reflux or if it is something serious, maybe related to the heart.
Yeah, sometimes people they do not pay attention to it, and they just keep on taking the antacids from over the counter, and they keep getting the symptoms back, because the antacid they will take, it will help them to suppress the symptom, but not to treat the underlying cause. So they definitely has to go see somebody and get this fixed.
Right. In one study, very interesting you brought it up, that the antacids, they're over the counter available. All those, you can find chewables which kind of release the acidity and bloating and all that. But there was one study done in the population where the individuals who were on prescription like proton inhibitors, and the complication is that people who took proton inhibitors after 1 year, there was a bone thinning, osteoporosis, because calcium was not getting absorbed in the system.
Yes.
That's one of the side effects of all the types of antacids, because we need an acid to digest calcium in the food. So, there is a give and take when people excessively want to take antacid all the time or want to be on those prescription drugs. So, that can have actually even more serious side effect on the long run compared to the acid reflux alone.
That is very much true. And also, I have seen in the young population, in the teenage, students, lot of students, they drink a lot of coffee to keep them awake.
Right.
And they are having a lot of issues, and then they are having antacid, and so then now they are not able to absorb the calcium too, because the caffeine also leaches the calcium
along with the
antacid, so which is even worse.
Jeopardy. It's a double jeopardy. It's really very tough situation for these individuals, not even understanding. Being a student, first you are a full-time student and you are having a lot of stress. You have to finish homework and you want to stay awake. You do it. So I think, what would you suggest with these type of guys, what they need to do?
Well, they need to first, if they are having some serious issue like this, they definitely need to see somebody, some sort of either naturopath, Ayurvedic physician, or whomsoever they want to see. But then they need to figure out what they are doing wrong. And also, Dr. Shailinder, it's not only the caffeine. The stress they have also is affecting their digestion too. Lot of people might have experienced they will start vomiting or they will start having diarrhea before an exam.
Right.
So
we call in Ayurveda Bhaya Jati Sar.
Yes.
Right.
So all these things, and so definitely they need to work with some physician, and also they can start doing by themselves, reducing the coffee, and then start eating well.
Right. And basically when you're having that much of stress, stress management is a very good issue which need to be, and it can be dealt very easily.
It can be dealt very easily. It can be, they need to do a lot of the breathing exercises we tell at the office to do, that helps them to reduce the stress. And
also, when people are in stress, they do stress-induced eating.
They do stress-induced eating too.
And that is not very healthy. What that means, folks, when you're doing stress-induced eating, either you are not paying attention what you're eating, what your attention on chewing is not there, and you're eating whatever is on your way, and you're eating fast. So all these things are not really friendly for gastroesophageal reflux disease or acidity, we call.
Yeah, and the chewing is the other step, which is very important. Like they need to chew the food properly.
Right. And, that's important. We always say that digestion begins from the mouth, and so you need to chew. So we definitely advise all our patients. So, folks, this is Dr. Shailinder Sodhi on the show Your Body's Natural Pharmacy, and we are discussing the digestive issues. Feel free to call us at 1-844-301-1250. It's again 1-844-301-1250, and that's the Desi Radio 1250 AM. And you can also actually do on your, if you have an app, you can also hear us on your phones or in your car. If you have a HD radio, you can listen to us at any time. We are here from 1 to 2 p.m. every Saturday. And so, Dr. Anju, the other second issue when we talk about digestive issue is a very common is a gallstone.
Gallstones.
Yeah. And gallstones actually, I think gallstones are like a little bit sex biased. In that,
I agree with that.
I believe the women are actually more sufferers than the men, and there is a reason why that would happen. That why women will have gallstones compared to guys is basically there is a hormonal issue, estrogen related issue. So, ladies, nothing but I think if you know somebody in your family had a gallstone, especially your mom, grandmom, or anything, you need to pay attention to this, because you could have something related genetic as well. And also that means you may be a little bit more estrogenic or a hormonally imbalanced person. So that can lead to these cholesterol stones in the body and in the gallbladder. So like when we talk about gallstones, these are small, hard, rocky like stones which are present in the gallbladder. And gallbladder is usually situated in the right upper quadrant in your body, just below the, under the liver. It's attached to the liver actually. And gallbladder has a very important function of, having.
It produces the bile.
It actually stores
it too.
Right, and it concentrates all that bile acids which are coming, our liver is producing. So, this is actually a very important organ which we need to keep healthy.
Very important.
Because of all the fat digestion which is related, the bile acids take part. So, the one of the things which when we are talking about gallstones, there are about 20 million people in the United States which are affected by that's again
a big number.
Again a big number. And when we talk about the gallstones, what we are paying attention to is your lifestyle. That is your diet is rich in fats, fried foods, or
cholesterols are high. If people they have the high cholesterol, that can lead to the gallstones.
Exactly, and people don't realize it. They always think high cholesterol just may be related to atherosclerosis, which is narrowing off or hardening of the arteries. That is one thing, but you can also develop gallstone. And the other risk factor for the gallstone is the smoking.
Yes,
it's a big risk factor. So if you are a female and if you have a hormonal imbalance, and on top you have a cholesterol issues, and you are a smoker, you have the very high probability that if you are having a pain, in abdominal pain, that you probably suffer from the gallstones. So folks, again, this is Dr. Shailinder along with Dr. Anju Sodhi. We're discussing digestive health. And, you can feel free to call us at 1-844-301-1250. And, we are happy to take your questions as we go through all the different issues which call the digestive issues in the body. I'll be happy to take any of your question and discuss in detail and give you what you can do alternatively, what are the, different diet patterns, different things you can do. And if you have a language barrier, हम आपसे हिंदी, उर्दू और पंजाबी में भी बात कर सकते हैं. तो आप हमें कभी भी इस नंबर पे 1-844-301-1250 1-844 1-844-301-1250. I will repeat that again, 1-844-1844-301 1250. तो ये है हमारा स्टूडियो का फ़ोन नंबर. आप यहाँ पे किसी वक्त भी हमें कॉल करें. मैं और डॉक्टर अंजू आपका फ़ोन अटेंड करेंगे और वी विल एडवाइज यू अकॉर्डिंगली. So feel free, folks, if you need to call, and we will take a short, quick break, and you will be back in about half minute.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
All right, folks, this is Dr. Shailinder Sodhi.
And this is Dr. Anju Sodhi.
And we are discussing digestive issues. In our first 10-15 minutes, we already discussed about the gastroesophageal reflux disease or hyperacidity, or acidity in commonly called. And we were, when we left before the break, we were discussing about the gallstones. So, folks, one of the main things when you are having a gallstone, the most common symptom is, the pain.
It's the pain. You feel the pain in the right side, right upper quadrant of the abdomen, and
we need to make sure to rule that if this is caused by the gallstone. So how you really know this is caused by the gallstone is usually people come and they complain about any time they eat heavy fatty food or where the fats are involved, red meats are involved, they get a very sharp pain in the right.
Which is called the gallbladder attack.
Yes. And if you are having every time like this, it's no joke, because it's one of the serious thing I have seen in my patients. I have seen patients in hospitals, where these guys are really suffering with a lot of pain. And when the reason it will happen is because these stones sometimes can pass through the bile duct. We call common bile duct, which is attached to the gallbladder. And so these stones can travel through the bile duct, and if they get obstructed in the bile duct, that is a very serious situation for the patient. And during that phase, the attack they have, the pain they have is enormous. And so, that's in the very, that's a scenario which might result into an intervention. That means these guys may have to go through the surgery, either removing the gallbladder and also opening up the bile duct. So, that can be serious, because whenever that happens.
Our recommendation to these type, if people are having this type of attacks, again, they need to see the physician, and they need to do, like, if seems like a gallbladder related to the gallbladder, they have to have an ultrasound. So it can be diagnosed that if they are having the gallstones, and then it can be treated without surgery too. Like if it's not like really bad, and if they are having like the small ones, then by changing the diet and taking some supplements for this can really help.
And then there are, again on that, if there are very few stones, 2 or 3 stones with the gallbladder, and they are not very big, less than 5 millimeter in size and all that, that can be treated and modified with the diet. And these type of patients sometimes can dissolve those gallstones with a little bit life modification and with the supplementation. Not every patient will be able to do it. Sometimes all those very big gallstones, they sit in the gallbladder. They are just, once in a while they will remind you that we are sitting here, and they don't need a whole lot of intervention because they are not causing attack. But if they do get serious, then that mean the gallbladder maybe have to be taken out along with the stone. So this is important. So folks, usually the gallstones will develop over the time. They don't happen overnight. There got to be all the risk factors which we discussed earlier. That means if you're a smoker, and if you're a female, and if you are a little bit obese, and you have cholesterol issues, the most probability of any time you eating a food is going to lead to gallstones if you are feeling pain every time you eat any fatty foods. So this is really one of the things which we pay attention diet-wise. So some of the diet improvement, Dr. Anju, what would you recommend to these type of patients?
I will definitely ask them to start eating the food which is low in the fat, and also reduce the red meat. They can eat still the fish, and they need to start eating more fiber.
Right, and that really helps. And along with certain supplementations, which really helps to thin down the bile acids, which doesn't keep them too strong, concentrated. And these type of treatments are available at the our clinic, as well as by the naturopathic physicians. So no need to suffer with the pain. And sometime when you do need a surgery, we can guide you accordingly. That's your final option. That's what you need to do it. And then the third most common digestive issue is which is a celiac disease in the population,
which is getting very popular these days, especially in the Indian population as well.
So there are more cases which are being reported. In one survey, an estimated 1 in 133 Americans have a celiac disease. 1 in 133. Wow. So that is a survey, and it's also estimated that 83% of people who have celiac disease don't even know that they have it, or been misdiagnosed with a different condition.
Yeah, some people can have like from the very beginning after the birth, and parents will not able to diagnose. Sometimes the doctors they are not able to diagnose it. Like they will keep doing the things which they are not supposed to do. Like if they are anemic, they will keep giving them iron, which they are not supposed to do.
Right. So this is very important that you need to get a right treatment. And you need to approach to the physician and come up with what is really going on with your child or with yourself. Like I said, 83% of these people who have a celiac disease don't even know that they have a celiac disease. What is celiac disease, you might ask? It is actually intolerance to gluten. And what is gluten? Gluten exists as a protein in the wheat.
Exactly. And in the Indian population, wheat is the major part of our food.
Right. And gluten is also present in the rye, barley, kamut. And sometimes there is a contamination of oats.
Contamination of oats too. Even though oats doesn't have gluten, but it grows with the wheat, so it is usually contaminated. But you can also buy the gluten-free oats as well.
Right. So the treatment is for the celiac disease is for the folks, those who have a celiac disease, is very much like avoiding gluten in entirety. You just cannot have a gluten, because it will lead you to have all the symptoms of the pain, bloating, diarrhea, and
the anemia
and malnutrition, I call it. So weight loss, all these things can happen. It is not always a diarrhea and celiac. You can also have constipation, bloating.
And they will have a belly in the young children, like 3-4-year-old. If you see they have the belly, it's just seems like why this kid has like a belly.
Right. That is why there is a little tummy pooching out.
So
in the small child.
That's a sign of the gluten intolerance.
It could be very much be a sign that they might have a celiac disease. And the testing is very simple. It's just a blood work where the blood is tested for the gluten sensitivities and see how serious it is. And if it is positive, then you are diagnosed that you cannot have gluten for the rest of your life. The thing is, people come to me, they said, okay, so that means I cannot eat my roti, I cannot eat my chapati, especially the North Indian population in Punjab area. We are very much in our breads. We love our wheat.
Yes.
So that becomes very complicated for the individual who really want to have a wheat.
But like Dr. Shailinder, as like we have lot of options. We have lot of gluten-free options now these days, so they can easily get the gluten-free bread.
So,
too.
what are your suggestions for these
So,
people who are?
I suggest my patients, there is gluten-free bread available too, but many times you need to see like what are the ingredients. If it's generally, if it's just they are using a lot of potato flour, lot of like the starchy flours, it's not that good. But the like if they are using like the other flours like the amaranth, millet, those type of flours are good.
Right. So some of the gluten-free choices the folks we have is, I usually recommend rice, brown rice, quinoa, lentils. You can use a corn flour.
Yeah, and I was talking for the bread. Like they can really make, if you are fond of eating the chapati, you can eat that like with the gluten-free flours.
Right.
So,
and I know you sometimes make.
I make 80%. I eat gluten free. Like I make chapati with the amaranth flour or the millet flour. And if its only problem is the binding, these flours do not get bind very easily. So I suggest like xanthan gum, which is easily available at any health food store or the like Whole Food or the PCC. And you don't have to put a lot. You have to put like 1/4 teaspoon. And you don't have to make the dough each time. You can make for a day or two and put that into the refrigerator. You can put some like the flax seeds into it too. And one key is like make the dough with the very hot water.
Right.
Hot water, make the dough with these ingredients, and you can really make it just like the way you make the roti, chapati. You can make it gluten-free roti.
Right, and the dosas, I believe, are also kind of gluten-free, aren't they?
Dosas are gluten-free. Like some of those are great. Those are like the rice and the beans too. But I do suggest to some of my patients are using instead of the rice, which is like more, if we are talking about a little bit more about the carb, then instead of the white rice, they can use the brown rice or the quinoa. Quinoa is great. Quinoa is gluten-free. Amaranth is gluten-free. And for the vegetarian population, amaranth, most of the people might know about the amaranth. And this is really great because it has a lot of protein and amino acids into it too.
Yeah, similarly with the quinoa is very good source.
With the quinoa is the very good source for the vegetarian
right.
people.
And we East Indian population are not known to buckwheat. Buckwheat is a very much a Russian fruit, which is actually fruit, but it comes into everybody think it's a grain. It is not. But that is also gluten-free. And it's called buckwheat, but there is nothing wheat
in it.
Right. So it is easily can be boiled and eaten as it is, and lots of our patients who are from Russia or that Eastern Bloc countries, they eat quite a bit, and it's a very healthy grain. Again, I mean, shouldn't be calling it a grain, but anyway, it's one of the healthy food to eat. So, folks, if you have a celiac, so the things you need to pay attention, gluten is completely out.
And also, if you are gone to some parties or like at the restaurant or anywhere, contamination, there is always some contamination so make sure that your food is not contaminated.
Right. Need to tell everybody that you are a gluten sensitive. You cannot have a wheat or rye or kamut or, barley. These grains do contain gluten. So, they need to be cooked separately. And lots of, I think I have seen some restaurants in our Greater Seattle area. They do serve gluten.
They do serve gluten-free.
And the best gluten-free choice is rice if you don't have anything.
Yes.
White rice is very good. And are there other foods where they add some starches from the wheat flour to thicken the curries? I think that needs to be...
That's very important too, Dr. Shailinder. You brought up, like, make sure that lot of sauces, the things you marinate with, might have some gluten ingredients. So you make sure that you read the ingredient carefully if you are really that gluten sensitive.
Right, and let if you are in the restaurant or somewhere, the server and the cooks know that they should not be adding any of those starches into the food from the wheat source. So that can be really problematic because that can lead to a celiac disease symptoms come back. And I know the folks who have it, it's really very paining because these guys suffer with the pain every day in, day out. So, folks, this is Dr. Shailinder Sodhi on the show, Your Body is Your Natural Pharmacy. And phone to call is 1-844-301-1250. आप हमें हिंदी में, पंजाबी में और उर्दू में भी बात कर सकते हैं. तो हम आज जो है अपने जो पाचन शक्ति पे बात कर रहे हैं और जितनी इसकी शरीर क्रिया की जो बीमारी हैं उन पे डिस्कशन कर रहे हैं. तो आप हमें 1-844-301-1250 पे कॉल कर सकते हैं. तो वी विल बी टेकिंग अ शॉर्ट ब्रेक एंड वी विल बी बैक राइट आफ्टर द शॉर्ट ब्रेक.
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
Welcome back, folks. This is Dr. Shailinder Sodhi.
Along with Dr. Anju Sodhi.
And we are doing on the show, Your Body is Your Natural Pharmacy, and we're discussing about the digestive health. And so far we have discussed about the gastroesophageal reflux disease, which is hyperacidity. We also discussed about celiac disease. And then we also discussed about the gallstones. Then the other, which is most common, is Crohn's disease. And the Crohn's disease is a part of a group of digestive condition called inflammatory bowel disease.
And like we get so many patients with the Crohn's disease at the office, and people do not know what's going on with them until they go to some physician and get this addressed.
So the Crohn's is most commonly affect the end of the small intestine on the ileum part, but it can affect other parts of the digestive tract as well. There are about approximately 700,000 Americans which are affected by the Crohn's. And according to the Crohn's and Colitis Foundation of America, which tells us that's quite a big number. And we have a phone call, and we'll be happy to take your phone call. Go ahead, caller. This is Dr. Shailinder Sodhi on the show, Your Body's Natural Pharmacy.
Yeah, hi, Dr. Shailinder. Actually, I'm a celiac patient from the last 11 years. And I tried the homeopathic medicines and the other medicines, but there is no result. So can you please recommend me any Ayurvedic medicines which can help me?
Okay, so the one of the main thing with the celiac disease, which like we were mentioning about earlier in the show, is it's a very much gluten issue. It's a gluten intolerance completely, where body cannot deal with the gluten. And we mentioned the gluten is present in the wheat, rye, barley, and that's and kamut, which has a gluten in it too. So the one of the treatment for the celiac is just completely avoiding the gluten from these sources. As for the treatment wise I usually recommend to my patients is they should be taking some sort of enzymes. Usually I call veg enzyme, which is a vegetarian enzyme base, and that can help with digestion. But no matter what happens, you cannot have a gluten, even after we suggest you taking giving you veg enzyme. And other thing, Dr. Anju?
The gluten, there is also available the gluten enzyme, which helps, like if you, by mistake, if you have eaten some gluten, or the food which has a little bit of the gluten in it, or it's contaminated, that can help you with the gluten, like you will not get sick due to that.
But it may be not 100% foolproof, because you still will get some symptoms, because the gluten can escape. So the problem with the gluten is that body just does not like it.
So like you mentioned that you have done the homeopathic treatment, but like most of the time it's you have to stay away from the gluten. And for the maybe rest of your life, there is nothing available. You can definitely have the things like the triphala or the enzymes and the probiotics to strengthen your digestive health, but you have to stay away from the gluten, dear.
Yeah. So thank you for calling us. And if is there any other question you have?
No, I'm fine. Thank you.
Thank you for calling, and thank you for listening to the show. So anyway, that's again a very people have to realize
Yeah,
it that-
people think that there is a really a cure. So there is sometimes like the homeopathy. Like I do get a patient like this too. At that, like they're doing some homeopathic treatment, and they can do a trial after some time too. And usually what happens, they get sick.
Right.
So we don't know like if there is any really if they can't digest that, if they can't have the gluten, they can't have it.
Yeah, it's just your body doesn't like it, so you
can't.
can't, because as soon you take it, the intestines go crazy. What to do with the gluten, which is a protein source of in the wheat. So anyway, when we left earlier, we were discussing about the Crohn's disease. Like I mentioned, there are about 700,000 people in the United States who suffer with the inflammatory bowel disease and usually fall under the category of Crohn's disease. And I mentioned that it's usually the terminal part of the small intestine called ileum. There is a inflammation, but though it can be patchy all around.
Yes.
And this is actually, Dr. Anju, as you know it, it's a chronic autoimmune disease.
It is a chronic autoimmune disease, and when people are suffering with this, it's really annoying. They are not able to digest the food. One thing, they are having a lot of symptoms, like they are having pain in the stomach, and they can have the other symptoms like the diarrhea sometimes too.
And bleeding can
be sometimes with the Crohn's as well, but it's a little bit more with the ulcerative colitis than the Crohn's, but it can happen.
It can happen because usually the Crohn's is a diagnosis which we usually take a small sample and give you biopsy report which confirms the diagnosis usually. But also there is a weight loss, and these are the people who can have a low-grade fever all the time.
Yes, as the immunity is very weak in these patients too. And
Right.
we will talk a little bit more about the Ayurvedic concept, we may not be able to talk completely about the digestive health today.
I think we probably have to come back
and,
again on these issues on the other shows. But meanwhile, that's the Crohn's is, like I mentioned, is quite a bit. If there is a family history, genetic history, and you're having digestive issues and you notice this, it's probably, the suggestion to all of my listeners is that you need to come, you need to see a doctor and discuss these symptoms with your physician. And then we have ulcerative colitis. Ulcerative colitis is another inflammatory bowel disease, which again makes about 700,000 people again suffers in America. The symptoms of ulcerative colitis and Crohn's are very similar.
Very similar, but in the ulcerative colitis, they bleed a lot.
Right. And it also affects the large intestine more often.
Lot of diarrhea.
Right. And these are the common things. Again, all these symptoms can coexist, and you could have Crohn's and it can mimic as an ulcerative, or it can be ulcerative colitis, and people might thought they have a Crohn's. So sometimes it takes a few visits before the final diagnosis is given.
And if there is no final diagnosis, the diagnosis can be given is the inflammatory bowel disease or irritable bowel disease, the IBS. A lot of people think they know what they have the IBS.
Right. So these symptoms kind of overlap
each other.
Right. So the one of the thing which we recommend, if you do have an ulcerative colitis and you do notice a little bit blood in the stool, it's definitely to be ruled out.
Yeah, it definitely has to be. If you keep on losing the blood into the stool,
and painful bowel movement and diarrhea or abdominal pain.
Abdominal pain, and it can be. Sometimes I have patients at my clinic when they are on the traditional medicine, but they are still having the symptoms. The reason is they are not avoiding the foods which they are not supposed to eat. They are still eating those foods and they are still having the symptoms no matter they are taking the medicine. And we have a very good, I was treating a patient recently and we got a very good results, Dr. Shailinder. And I'm able to cut down her medication. She was on the Lialda, and I'm addressing this issue with all the Ayurvedic herbs and the dietary modifications. But she is a good patient. She is able to do whatever I say. and she's very happy with the results.
I think it's also compliance is a thing. When patients comply according to, then usually results are good.
Results are good.
Because especially...
And she started gaining weight. She was losing weight as well due to that.
Yeah, so when you are not digesting food, of
Yeah.
course, there will be weight loss. You will be having muscle loss as well. So, if you're feeling, all these symptoms of weakness, abdominal pain, painful bowel movement, diarrhea, constipation, or blood in the stool, feel free to come to the clinic. So, folks, this is Dr. Shailinder Sodhi on the show, Your Body is Your Natural Pharmacy, and we're discussing digestive issues. And the phone to call to us is 1-844-301-1250. Again, 1-844-301-1250. अगर आप हमारे साथ हिंदी में बात करना चाहते हैं तो आप हमें 1-844-301-1250 पर कॉल कर सकते हैं. आज का जो हमारा टॉपिक है वो जो डाइजेस्टिव सिस्टम पे है. अगर खाना आपका पचता नहीं है, खाने के बाद अगर आपको दर्द होती है पेट में या ब्लोटिंग होती है, गैसियस फीलिंग होती है, तो उसके लिए उस टॉपिक पे हम बात कर रहे हैं. तो फील फ्री टू कॉल अस इन हिंदी. आप हिंदी में भी हमारे साथ बात कर सकते हैं, उर्दू और पंजाबी में भी बात कर सकते हैं. सो वी विल बी कमिंग बैक आफ्टर द शॉर्ट ब्रेक अगेन एंड वी आर डिस्कसिंग डाइजेस्टिव इश्यूज.
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Hello folks, this is Dr. Shailinder Sodhi.
And this is Dr. Anju Sodhi.
And we are discussing digestive issues. Before our break, we were discussing about the ulcerative colitis and Crohn's. The other most common thing is irritable bowel syndrome. Like Dr. Anju was saying, sometime when we are not able to diagnose the ulcerative colitis or Crohn's, then usually there is a diagnosis of irritable bowel syndrome, like you were saying.
Yes, many times we get people when they come with they may not have like the complete like the Crohn's or the ulcerative colitis symptoms, but they come with the like lot of the digestive dyspepsia. They can't digest the food. They feel the pain in the abdomen whenever they are eating. So there is some inflammation into the gut.
The only I think the fine line in the Crohn's and ulcerative colitis versus IBS is these are the individuals who will have at least 3 times in a month for several months stomach pain. And they will have bloating.
They will complain about when they are eating at the school or they are eating at the after coming back to the school in the morning. Doesn't matter. They get the pain. Sometimes on the regular basis, every day.
Yeah, it's about 10 to 15% of the U.S. population which suffers from the irritable bowel syndrome. That's quite a bit.
That's quite a bit.
That's like 10 to 15 people out of 100 do have irritable bowel syndrome. So that's one of the things which we are discussing. So we have a phone call and caller, go ahead. This is Dr. Shailinder Sodhi on the show, Your Body's Natural Pharmacy.
Hey, Dr. Shailinder, how are you?
I'm fine. Go ahead. What is your question, caller?
So I'm Kunal. My question is what is the relation between digestive problems and probiotics for curing it?
Okay, no, there is no difference, but I think the question is when probiotics are the healthy bacteria which our gut has, we have more than 300 trillion different types of healthy bacteria in the gut which sits in the small intestines to large intestine, which helps in digestion. Some of these are bacteria which are actually exist in the mouth cavity to the oral cavity. So these probiotics actually really what are our kind of defense line in developing immune system, also digesting food properly. So probiotics are usually, when we store these we call them acidophilus or bifidobacteriums, which are present in the gut lining and the mucosal lining. And so what it is like, when you eat a yogurt, it has all that fermented material will have some sort of probiotics in it. So these foods, which we'll be discussing in next few minutes, are very healthy material for the intestine and keeping digestion strong. So keep listening to us, Kunal, and we will be bringing this talk. We will talk about how probiotics helps with the digestive system. So thank you for your call.
Yeah, sure.
So anyway, we were saying that irritable bowel syndrome, about 10 to 15% people suffers, and what causes actually IBS is mainly is a diet, such as an avoiding if you avoid dairy and alcohol, caffeine, sugars, and sometimes certain beans, and these can actually reduce some of the symptoms.
These definitely reduce the symptoms, and usually I go with the remove all the allergens, like the dairy, wheat is the main allergen, the sugar. I remove all the allergens from the diet, and also I cut down their, like some people sometimes I get they are eating a lot of raw vegetables, which they are not supposed to eat if their digestion is not strong, or we call with the Ayurveda this Agni, and they keep on eating the stuff which is not good for their gut. So they need to eat the vegetables not raw but little bit cooked, or like
A little bit steamed.
Little bit steamed, so they can easily digest it. And also I cut down the cruciferous family, which is like the cauliflower, cabbage, broccoli.
Yeah.
They can eat some, either or. They can't eat all those vegetables in one day.
The other thing in Ayurveda is sometimes we advise our patient, okay, if you really love these, we need to add either ginger or
Ginger is actually, Dr. Shailinder, ginger is great, like, because when people are having like this irritable bowel, they are not digesting the food properly, and the ginger, like with some lemon juice, take inch of the ginger with the lemon juice, a little bit of the salt before eating, can be really helpful with the Agni, or the we call it Agni for the digestive fire. With
or
the
they can
Ayurvedic,
cook with a lot of ginger.
They can cook with a lot of ginger too, or they can have also like taking half to 1 teaspoon of the ginger powder and mixed with the water before the meals can be very helpful too.
Right. And the other most common problem, sometimes people come, which is sometimes very annoying, is an hemorrhoid.
Hemorrhoids, yeah. Again, hemorrhoids is again secondary to the constipation. So constipation can be like they have to push, and then they start having developing the hemorrhoids.
Right. Hemorrhoids are just like it's like a venous, malformation where
like you have the varicose veins.
Right. It's just like that, which can happen. You can have internal hemorrhoids or external, and most time people don't know why they're having a little bit streaking on the stool, and that can be very simple as an hemorrhoid. And usually, it's a very easy fix. That usually having more fiber, drinking more water, and having an active lifestyle helps to heal them.
Walking before, like after eating, 20 minutes of the walk, 15 to 20 minutes of the walk after eating is really helpful with the digestion. And also for the hemorrhoids, like the constipation, they can't be constipated. If they are constipated, and if you do not address that and have the hemorrhoid issue, you will keep on getting these hemorrhoids more and more.
Right, and there's the easy fix is hydration.
Hydration is very important, and eating more fiber. These days, people do not eat fiber. So,
right. And the other thing is diverticulitis. These are pouch-like growth on the large intestine, which can sometimes cause pain in the left lower quadrant, and they are it can be genetic. So, and again, the diverticulitis can also cause rectal bleeding, and there can be fever, abdominal pain, and usually I find it's most common in obese people.
Yes.
And sometimes if they do get infected, then there is
antibiotics can need to be taken.
Right. And so anyway, we have discussed so many different issues. I think if we take individually each issue, it will take probably 10, 12 different shows which we have to do it, but without wasting much time. Dr. Anju, what are your recommendations for the people who are having digestive issues in general? One of the callers asked about the probiotics and other things.
Yeah, so first of all, I would like to tell them that why we are having these symptoms. I just mentioned a little bit in the brief, like that it's a Agni, which is the digestive fire. So we need to, if digestive fire is weak, we are having these symptoms. So to make the digestive fire strong, we need to, like that ginger powder, I talked about the ginger powder, so that can be done. And so there is other factors too. You need to do the meditate on the food. You need to drink, eat slowly. Do not eat like the quick, and chew your food properly.
We call it chew one by 32 times for each tooth.
Other thing is the cold water. People drink a lot of cold water, ice cold water with the meals. That's not recommended.
It slows down your digestion.
It slows down your digestion.
So warm green tea or ginger tea would be very helpful.
Tea would be very helpful. And eat your largest meal at the lunch time when your digestion, your Agni is strong at that time, and dinner should be a lighter meal which can be digested easily.
And
before
don't hit the bed right after eating dinner.
Right after eating. Yes.
That's the most common thing I say.
Especially in the Indian population.
Well, actually,
they eat late.
I see even in the Western population as well.
I
think people are so busy that they forget that they need to eat dinner by 6:30 to 7. They're actually eating late dinner, and next thing they know that they want to retire in their bed.
Yes.
So that actually is causing weight gain in their obesity.
So walking after eating morning and evening would be very important rather than walking at once 45 minutes. If you folks, if you walk after dinner or lunch 10, 15, 20 minutes would be really helpful too.
It's very helpful because food does not sit in the stomach that way. It is already moved into the small intestine.
Yes.
And the rest of the time then body will take care. But if the food sits in the stomach and you hit the bed, guess what is happening? You're sleeping, and our biorhythms are just kicking in, and that says, all right, we need to slow down.
These were some simple tips. We have to, like a lot of things, start eating lot of fiber, start eating a lot of green vegetables, drink a lot of water. Do not drink the ice cold water.
And take some probiotics.
Take some probiotics. Those are very important, like as one caller asked about it. And people eating yogurt is very good too. But some people may be allergic to the dairy. They may not be able to eat.
There was a question of lactose earlier we were discussing. So
and,
the lactose intolerance is an issue. So if you are lactose intolerant, you need to pay attention to that as well. So that's the thing. And also,
and Ayurveda, like the Triphala is maybe a lot of people might know about the Triphala, which is great. Like it's a Harad, Baheda and Amla. And you can take it before meals, every meal. That really helps with the digestion. So Triphala, enzymes and some probiotics will be really helpful with your digestion. And there is a lot of other things. We may have to do another show on the digestion.
I think, the show,
because we are running out of the time.
So anyway, folks, the Triphala I call is a rasayan, which is actually life of the your health. So take it every day along with the probiotics. So anyway, this is Dr. Anju's along with me. So some suggestion which she given, I think those are great suggestions by Dr. Anju. We both practice at Ayurvedic Naturopathic Medical
Also,
Clinic.
Dr. Shailinder, maybe we can talk next time whenever we are doing on the digestion about how they are cooking, what type of oils they are using. There is other factors too which we need to address. Today we just addresses like some of what are the issues. But maybe next time we will address the other things too.
Right. So anyway, folks, we both practice at Ayurvedic Naturopathic Medical Clinic in Bellevue. And our clinic number is 425-453-8022. Again, we both practice at Ayurvedic Naturopathic Medical Clinic. तो आप हमारे फ़ोन पर क्लिनिक पे कॉल कर सकते हैं अगर आपको डाइजेस्टिव इश्यूज़ हैं, डाइजेस्टिव हेल्थ इश्यूज़ हैं, अगर आप हमें देखना चाहते हैं. तो हम दोनों आयुर्वेदिक नेचुरोपैथिक मेडिकल क्लिनिक बेलवी में प्रैक्टिस कर रहे हैं पिछले 22 सालों से. तो हमारा कॉल करने का नंबर है 425-453-8022. So we also cover other issues in the health as well.
Yes, and if you come up with any issue, then please let us know. We will cover that.
Thank you, folks.
Thank
Have
you.
a good one.